Hello everyone. I wanted to talk to you at the start of the new financial year, and so today's podcast reflects on some of the big challenges that we've had over the course of last year and some of those that face us going into this new financial year. The first thing I wanted to do was thank everyone for a sterling achievement. We've managed to achieve the 4-hour target for 98% of patients through the emergency department in 4 hours, which is fantastic work. I'm delighted with the effort that's gone into that, and in fact it's the first time in 5 years that UHSM has delivered Q4 during the heart of winter, the emergency department target. So it's a terrific achievement, and so many people have been involved in enabling us to do that. The many changes that we've seen in terms of changing some of the systems and the way that we operate the ward rounds, the new GP assessment unit, the whole system of emergency flow through the organisation. There's been some many changes, but they've had a really positive impact in terms of trying to ensure that we're more streamlined and we are effectively shortening the time that patients have to wait. So I just want to thank everyone for that, and also to say that we've had a terrific year bearing down on infections. MRSA rates are an all-time low in terms of what we've managed to achieve this year, which is fantastic. And I was pleased that everyone got involved. A lot of you got involved in the Beat It video. I've had some stick for that from a number of folk, but I think it was important that we communicated a serious message in a light-hearted way that shows us working as one team. So well done to everyone involved in helping us do that. And Susan promises me that there'll be more of these to come, so I'm not quite sure what to expect. But nevertheless, there is the serious point that we've delivered a much safer service for patients in terms of reducing infections, which is terrific. On 18 weeks, which is the other area of concern that we had with the regulator and why we found ourselves in significant breach of our terms of authorisation, which is very serious for a foundation trust, it was 18 weeks, and we're really, again, made huge progress on that. And people have worked hugely hard to treat more patients, particularly through the difficult winter months, and we're now optimistic about our ability to hit the 90% target for admitted patients being seen within 18 weeks, which is terrific. Still some big challenges in a number of areas, particularly orthopaedics, where we've got a high demand, but nevertheless, great teamwork, great effort, and we expect that we'll be performing in that area as well. And the other thing to say is that the Care Quality Commission have given us a clean bill of health, a clean registration. All healthcare providers are now registered by the Care Quality Commission, and we've been registered without any conditions. And there are over 167 or thereabouts conditions or standards that are looked at. So we've had to have evidence on every single one of those which relate to patient care, and to come out with a clean bill of health is terrific. So on all those areas, we've made huge progress over the last year, and I am very, very grateful to all of you for your efforts in that. And for me, it validates the work we're doing on the South Manchester Way, which is about working as one talented team with patient care at the heart of all we do, and of course striving for excellence. And all of those things, I think, are exemplified in those achievements. Looking ahead, of course, major challenges that we face in the new financial year, particularly in relation to productivity and efficiency and resources. We'll have an election shortly. Whoever wins, we expect that there'll be significant pressure on the public finances, and we in the National Health Service will have to live within our means. And here at UHSM, we need to save around £12 million over the course of next year, which, if you break it down, is £1 million a month, not to be underestimated. So we've got quite a lot of programmes under our Fit for 15 project to try to deliver that. Things like procurement, things like ensuring we work more efficiently, looking at our use of agency staff, a whole range of areas, our management costs. So there will be changes, and there will be some tough times ahead for us, and we will have to take some hard decisions. But we have to do all of that in the context of patient care being at the heart of all we do, and remembering that. So while we move through that period, please bear in mind the key parts of the South Manchester Way that are so important in terms of keeping us on track and ensuring we provide great care for our patients. So I think that's all for this month. I'll keep you updated on progress and where we are and many other means of communicating. But do please feel you can give me some feedback on what you've heard, and indeed anything else through the Ask the Boss facility and the regular team briefs that you should be getting. So thank you again. Well done for all those great achievements during the course of the year, and here's to a very successful 2010. Thank you very much.